Hi, my name is Tara Dominguez. I am a pharmacist and I am the CEO and founder of TD Pharmacy Services. So I started as a clinical pharmacist in a health system, a very large health system in Oklahoma City, and I was a hospital administrator. So I had gone through COVID and I saw all these changes and shifting and just things that, were really making me feel burnt out. And I also saw that the health system wasn't working how it should be. It wasn't optimal. Patients kept on coming back in time and time again, and they never really seemed to be fixed. So I said, okay, I could see a bigger and better, plan for these patients to prevent them from having to constantly come back into the hospital. So I had started researching a little bit about chronic care management, remote patient monitoring, and I thought, this is really what Oklahomans need. This is really the advancement that they need in healthcare. So I founded TD Pharmacy Services as a closed-door, non-dispensing pharmacy that was just going to do clinical services to help people basically live the healthiest version of their lives. So my customers are people who really want to advance their health, and they really see the value in advancing their health and want services in a timely manner. I do functional medicine services for people who have gut health issues, as well as pharmacogenomic testing for people whose medication quite isn't where it should be, that they don't feel like it's optimized. They feel as if they have a lot of side effects from their medication, or they're on antidepressants and it's not really helping them. So we do testing there as well to see what the best drug is for those patients. Also do nutrigenomic testing, which is basically a fancy way of saying how does the nutrients that you put in your body affect your genes and vice versa. It was actually very serendipitous. I was just looking for an office space and I came across Project 3810. It's about 1.5 miles from my house, and I thought, oh, that'd be perfect. Just be able to drive through my neighborhood and go to work. And then I found out what a business incubator was and all the great benefits of being in a business incubator. I came in, I met Vicki and Julie in the front, and I just fell in love. Fell in love with the space, fell in love with the community, and I decided that it was just perfect for me. It was awesome to have, especially Vicki, being this amazing entrepreneur she is, to have her come in and kind of see my business and what I wanted to do in a different light. So it's been awesome from that standpoint, as well as just meeting other business owners who have, came and gone as well, and that are not in the healthcare space. So that was very valuable, having other entrepreneurs in other industries and see how their business works and their trials and their wins and how to network outside of just, healthcare. So it's been an eye-opening experience. It's given me the confidence to go out and meet other entrepreneurs outside of, Project 3810, outside of Oklahoma, and really grow my own business. So I have grown so much over the past year. I really feel like hiring a business coach like Vicki has been pivotal for my business to kind of see where I should go and what I should do, and having someone who's accountable to you and wants to cheer you on. That was what I needed, and I think a lot of other people will find that that's what they need in order to grow. You have to have a wonderful network of other like-minded business owners to really help you grow. Me as a pharmacist and medical professionals in general, we don't get a whole lot of business training. So going out on our own and thinking, okay, I'm going to start a practice, can be a little overwhelming, and also it takes a lot of courage to do that, because you are already in a great job making great money. But going out on my own, I was able to find myself, who I was, who I truly am, and what I really want to do with the rest of my life, which is, help other businesses grow their clinical services.